Welcome to Time for Health. I'm Rachel, your host, and I'm super glad you're here, and I'm glad Tracy's here today. As always, we bring a guest on the show who's kind of an expert in a certain field to share a little bit of health wisdom with everyone. But as always, the best thing you can do for medical advice is don't necessarily just do everything that we say here. You always want to talk to your doctor first about any plans or conversations you need to have. Make sure you talk with your doctor or your nurse practitioner. So today, Tracy Stadler is our guest. Welcome.
Thank you.
And we're talking about diabetes, which
Great topic.
is, a really kind of prevalent topic, unfortunately, I guess. So tell me a little bit about yourself and how you got to be an expert in diabetes.
Well, probably because I've been around a little while. Again, my name is Tracy Stadler. I'm a registered dietitian. I am also a certified diabetes educator.
That's right.
I've been a registered dietitian for about 27 years and about 17 years as a certified diabetes educator. So I've seen a lot of things over the year, but diabetes is definitely my passion.
Okay, and that has changed a lot over the years, I am certain.
It does change. Good changes.
Yeah.
I've seen a lot happen over the years. I've seen many new medications that do different things. Years and years ago, what was our only option? Probably insulin. Now there's so many things that you can try before actually going to that.
Gotcha. Okay. So I know just enough to be dangerous, so get ready.
That's all right.
Okay. So there's type 1 diabetes and type 2 diabetes, and then there's pre-diabetes. Talk a little bit about each one of those and what they are.
Okay, well, let's start with pre-diabetes.
Okay.
Pre-diabetes is what we used to call borderline diabetes.
Okay.
We always had to wait to cross that border.
Yeah.
Well, that is now given a name. It's pre-diabetes, and that means when your blood sugar is running higher than normal, but not high enough to be called diabetes. Kind of the beginning stages of diabetes.
Okay.
So then you have, once you cross the border, you can be either, once you cross the border, you'd be a type 2. So let me distinguish between type 1 and type 2.
Okay.
Type 1 is an autoimmune disease where your body actually attacks itself and it kills off the cells that produce the insulin, which is the key to open up all the little doors on the outside of the cells in your body to allow the sugar in to fuel your body.
Gotcha.
That individual is completely dependent on either injections of insulin or they can use an insulin pump.
Okay. Now, is that diagnosed early in life?
Well, years ago it used to be called juvenile diabetes. We don't call it that anymore. I've seen people in their 50s being diagnosed with type 1.
Okay.
But
that's a little bit different. That's an autoimmune.
Yes.
Okay.
Yes.
Okay.
And that's actually the smaller percentage of diabetes.
Okay.
The larger percent of diabetes that is diagnosed is type 2.
Okay.
Which can happen for several different reasons. It can happen, let's say your body just isn't working the way it used to. Maybe the insulin isn't as adequate as it used to be. Maybe there's not as much as there used to be. Maybe there's something going on with your liver, which most people don't realize that can affect your blood sugar as well. So there's just some different things, or everyone loves to hear this, maybe we just have too sedentary of a lifestyle and we tend to carry a little extra baggage, usually around the middle, that's the hardest part, but it makes it harder at that point for the insulin in your body to do its job.
Okay.
So a variety of things can be happening for that.
So pre-diabetes is, what is there a magic number? And I think that magic number has changed over the years, like what your blood sugar level is.
Sure. So it depends on what you're looking at. If you're looking at a fasting blood sugar, you would want it to be less than 100 to be normal.
Okay.
Okay.
And so fasting means you haven't ate or drank anything
correct,
for about
8 to 10 hours, something like that.
Okay.
So
100 is the magic. You want it to be 100?
Under 100.
Okay.
Anywhere from 100 to 125 is that pre-diabetes range. Okay. Then above 125, so 126 or higher would be diabetes.
Okay.
You can also diagnose it with what we call an A1C.
Okay.
Which is a simple blood test that can be taken, and what it does, it looks at your red blood cells, which average lifespan is about 90 days, so it can look back over the last 2 to 3 months to see how much sugar is coded to that red blood cell. It's a test that can't be fooled. So a lot of insurance companies will use that as a diagnostic criteria. I can tell you, Medicare does not use that as a diagnostic criteria. They'll eventually hop on board, but right now they're looking at the fasting blood sugar.
Okay.
But if you want to know an exact number, less than 5.7%, and that is the A1C. The results come back in a percentage,
Okay.
which correlates with the blood sugar reading.
Okay.
So less than 5.7 would be a normal A1C. Anywhere from 5.7 to 6.4 is again that prediabetes range, and then above 6.4, so 6.5 and greater is diabetes.
Okay. Now, if somebody has test their blood sugar and they've been fasting and it's 125 once, can it be off once? Or is it, if it's 125 once, you have prediabetes?
Usually what we look for is 2 fasting blood sugars of 125 or greater within a 12-month period.
Okay. Okay.
So yes, I've seen where they've taken one, it's 126, and the next one might be 110, or however the case may be.
Okay. And that's where you work with your doctor, your nurse practitioner. They might order lab work, that kind of stuff.
Correct.
Okay.
Correct.
So that's prediabetes type 1 is something not necessarily juvenile or not necessarily diagnosed when a person is a child, but that is...
It's just that autoimmune where the body attacks itself,
Okay.
and then there's no longer any insulin made in the body. So they are dependent on those shots. Think of prediabetes, and I don't know if I said it, so think of that as the beginning stages of type 2 diabetes.
Okay. Okay.
That's what I meant to say.
Yep. Okay. And so how all this develops, so type 1 diabetes is more of a, you're born with brown eyes, and so, or you're born with type 1 diabetes, or your body is predisposed to type 1 diabetes?
You can. Sometimes it is genetic.
Okay.
Other times it could be triggered by a bad virus.
Oh.
A lot of, so I've seen kids where, they'll come in and out of nowhere. They have no family history or anything, and they've been diagnosed with type 1, and you can kind of trace back, have you recently been ill? And they're like, well, yeah. And sometimes it just triggers that.
Okay. What are some, I know blood work is involved, but what are some signs for either maybe type 1 or type 2, and are the signs different?
Sure, and the signs would be the same actually.
Okay.
And again, when you hear some of these signs, a lot of people will say, well, I never noticed those signs, typically in a type 2. They'll say, well, I never had anything. Some of these signs can be attributed to so many things. Increased thirst, you're very tired, you can be very hungry. Again, no energy. There's just so many things
that could be a lot of things.
Constantly running to the bathroom. So yeah, a lot of times they'll say, well, think about it. It was in the summer, so it's been 90 degrees outside, so, and you have an outdoor job, so you're really hot. So of course you're drinking a lot.
Gotcha, yeah.
And then you're going to be up all night running to the bathroom because you've been drinking a lot all day. So, and you're tired because you work 100 hours a week.
Yeah.
So sometimes,
like
you got to dig down deeper to see.
Okay.
But those are classic signs.
Okay. And then with type 2, signs and symptoms are a little bit the same thing.
Yeah.
Okay. And that can be brought about, again, by just something malfunctioning in your body, but also...
Genetics as well.
Okay.
Can't fight those genes.
That one also, is there a percent of people where it's kind of brought about by lifestyle, like you were talking about, a sedentary lifestyle, not eating?
Probably a larger percentage of that would be brought about by lifestyle. Not everyone, but what I will say is that although our screening practices have gotten a lot better over the years, an individual can walk around 4 years with a high blood sugar and not know it.
Gotcha.
Diabetes doesn't hurt. High blood sugar doesn't hurt. That's why we rely on that lab work.
Gotcha.
Typically what we recommend to people is at the age of 40, you want to start getting regular
Testing
screenings.
for it, okay.
Okay, especially if you have a strong family history. Sometimes if I know someone has a very strong family history, we start encouraging them at the age of 35
Gotcha.
to get checked, because the earlier you catch that, If, let's say, you're caught in that pre-diabetes stage, you can do something about it at that point. It can be reversible, or it can delay the progression of the disease to type 2 for a long, long time.
Okay.
So if you do catch it in that stage, that's when you want to work on it. You really need to, start looking at those eating habits, start looking at the activity. How much activity are you getting? Are you a couch potato? Are there some things that you can do? Do you spend too much time going through the drive-through? Maybe you can start limiting things like that.
Gotcha.
It's not that you have to give those things up, but simple changes can help get that body back into shape and reverse those numbers at that point.
At that point.
Once you cross over and you are diagnosed with type 2, you have it. Now, what I will say is it can be managed. It's a self-managed disease, and you want to control it. You never let it control you.
Gotcha.
That's when it becomes nasty and all those bad things happen. They don't have to happen so long as you can control it.
Gotcha.
Being controlled, though, is different from saying, I got rid of it, or I changed it, I fixed it, I'm cured, I don't have it anymore.
Gotcha.
If you go back to the previous eating habits or whatever the case may be, it'll catch up with you again.
Are children diagnosed with type 2 diabetes?
The youngest that I have seen was 8 years old.
Oh, okay.
So yeah, again, it's the lifestyle. It's, what are these kids eating? How much are they eating? Are they left in front of the television as the babysitter? Got that, it's easy to do. I get it. I'm a mom. I understand that.
Yeah.
But allowing them to sit there with a bag of chips and stuff like that, that can get the...
Do the
little
signs
kiddos.
and symptoms look the same in kids, like for parents to look out for?
A lot of them, yes, will
Okay.
look the same. There is another sign called acanthos nigricans.
I'll take your word for that.
All right. So what it is you can find it in like the folds of the skin. It looks like really dark leather, dirty skin. That's a sign as well.
Okay.
Okay. And you can scrub, and that's typically where kids that are type 2s, they
Okay.
get made fun of in school.
Okay.
And they say, oh, he's dirty. He's not dirty. He's not dirty. It's just a symptom of the insulin starting to not work the way it used to, and let's see what we can do about it.
Interesting. It seems to me that it's growing in prevalence. Are there more people around here with diabetes?
I think there's more people around a lot of places with diabetes.
Okay.
Again, quite often, not always, I attribute it to the more sedentary lifestyle.
Okay, all right.
But again, depending on what stage we're getting it at, and we would love to get it in that pre-diabetes stage where we can do something. And I'd love to get out in the community more. And that's my goal, to get out there, work with the area providers, and let's catch them early, see what we can do.
Okay, awesome. I'll tell you what, we're going to take a quick break, and we will be right back. We're back, Tracy and Rachel, talking about diabetes. So before the break, I asked you about, is it on the rise, or how many people around here? And you actually have some numbers about how many, what percent of people in Ottawa County, I think, have diabetes?
Yes. What I have are 2017 statistics. I'm still waiting on 2018 to come out. But in 2017, about 11% of people in Ottawa County have been diagnosed with diabetes. Talking a little bit about the sedentary lifestyle, making a contribution to that. About 63% of adults in Ottawa County are either classified as overweight or obese. Okay, so some of this is part of that sedentary lifestyle. And about 10 to almost 11% of youth, that would be grades 8 through 12, are overweight or obese. So,
got a little work to do.
we got some work, but we're working on it. We're working on it. We're going to make a difference.
Yes, we are. And so we talked about kind of what makes that increase. Is some of it is just genetic, or things malfunction in the body, just like a lot of things.
Don't do what they used to do.
But some of it is are things that you can control a little bit. So
Yes.
that's actually a hopeful message. So that's good. You talked about treating diabetes and managing diabetes and pills and pumps and insulin and all that. Talk a little bit more about how all that works. Like, do you start with one, and when that doesn't work, you go to another thing? Or
Sure. There are different options, many different options out there now. Often I will see people start out with nothing. They can try it with diet and exercise alone, making some simple changes in their portion sizes, the types of foods that they're choosing, getting a little more active, maybe getting rid of some of the little extra baggage that they may be carrying around. And that right there, I mean, exercise typically is another medicine without having to pay for it. So that's pretty cool.
Right.
So if you want to look at that as a medication, that is oftentimes where people start, depending on where that initial blood sugar is when they're diagnosed. So if it's running higher, often I'll see them start on an oral medication, and there's so many different ones.
There are.
Yeah, there are. There is actually an algorithm or a chart, if you would, that gives providers a good idea of what may be the best place to start. Let's start with this. If A, B, and C, after so many months, let's try X, Y, or Z. So they have a little, system that they can work through to find some proper meds. So bunches of oral medications. Years ago, when I first became a certified diabetes educator, I thought there were a lot then. There's so many now, some of them I can't even pronounce. And they do so many different things, but it's great. It's great because there are so many options out there. So there are, whether you do it diet and exercise, there are oral medications, there are what we call injectables.
Okay.
Not insulin, but injectables.
Okay.
So if you were to watch, there's so many commercials out now. Some of them I see Trulicity. What are some of the other ones? Victoza.
Okay.
Some of those are injectables, not insulin, but they do several different things in the body, and they're really good medications. Okay. So after that comes the actual insulin. Okay. So I always, share with people, don't get too concerned. Not maybe that's not the word I'm looking for, but they get really worked up if they're on an oral pill and their blood sugars aren't running, within that normal range yet or where they want it to be, and they think they're going to go right away to insulin. That's not the case. There are many other steps that can be tried before.
And what's the highest insulin number you've ever seen that somebody's blood sugar was?
The highest blood sugar?
Yeah.
The highest I've ever seen is 1,600.
Oh my! I didn't even know it went that high.
I know, right?
Oh, okay.
Yeah.
Wow. Now, and people, as they're trying these meds, is it true that even if your blood sugar isn't down under 125 or under 100 fasting or whatever, if it's kind of normal for you after a while, or is the goal always to be?
The American Diabetes Association guidelines are fasting in the morning in order to keep future complications at a minimum, or your risk for those complications at a minimum. You want it to be anywhere from 80 to 130.
Okay.
Now, anywhere from an hour to an hour and a half after the first bite of a meal, also American Diabetes Association guidelines, it should be less than 180. Okay. Now, the American Clinical Endocrinologist, ACE, I believe it is.
Okay.
So it's the Endocrinologist Society. They're more strict, which is fine. So their numbers are a little lower. Now, the A1C also, American Diabetes Association likes to see at less than 7. Again, to keep your risk for future complications at a minimum. The endocrinologist group, they want it a little lower.
Okay.
What you need to keep in mind, which they do as well, we want it lower, but still avoiding any low blood sugars.
Right.
So not too low.
That's true.
Exactly.
There is the other side of that, like blood pressure.
Yes.
You want to manage it, but you don't want to go to the other extreme either.
Right.
So there are diet and exercise.
Yes.
Pills, oral medications, injectables, insulin, and then an insulin pump. Talk about insulin. Do people give it to themselves? They don't have to go into a...
For an insulin pump?
Or injectable insulin.
Oh yeah, they do that all on their own. They can either be trained in the provider's office or maybe go through a diabetes education program where the nurse will go through with them and make sure they understand how to inject themselves.
Okay. And a pump, how does a pump work?
Oh, a pump is very cool. A pump is very cool, and boy, have they come a long way. Yeah. The pump is actually, the tubing is inserted into the belly. There's other places too. That's the most common place. Just a little poke, and then the needle actually comes out. It's like a little catheter thing that's left in the body, where the tubing then connects. One end to the body, the other end is connected to the pump. So they can carry this pump just like back here.
Yeah, like a pager.
You got it. You got it. It's amazing. And especially kids that wear pumps, they come up with all different, they'll make them little things. They can carry it all over the place, and nobody's going to know. So what it does, actually now, pumps have come to the point where we call it a closed loop system. If the blood sugar is getting too low, the pump knows it because it's also working with what we call a continuous glucose monitor, so it knows the readings. Oh. And if that blood sugar is starting to get too low, that pump is like, uh-oh, stop. So it actually, instead of just notifying like it used to, just notifying the person, hey, your blood sugar is getting too low, and the individual does something, now it will take care of it with that closed loop system. So they're very...
That's quite an advancement.
They're wonderful. They are wonderful. And kids especially, they're like little sponges. And they can just, they're so good with them.
They learn.
They are so good with them.
Very
exactly. Yeah. You either put in, or however they do now as far as how much carbohydrate, what they're eating at that meal. Okay. So then once you put that in, the pump knows how much to give, because you actually set different goals within there in the pump, so it knows where you want to be at whatever time.
That's kind of cool.
Yeah.
So back to the question, you kind of touched on it earlier about being cured, or so if you have prediabetes, or even if you kind of cross the line and you have diabetes, there are instances, not necessarily everybody, where you just really knock it out of the park with lifestyle things or whatever, and you can kind of reverse it.
You can well manage it.
Okay.
And you can keep it under excellent control.
Okay.
And at that point, what we're looking for is numbers that somebody without diabetes would have.
Okay.
However, like I said, you can fall back into old habits, which is not hard to do. Right. We're all human.
Roger that.
And those numbers can start creeping again, which is the importance of monitoring.
Gotcha.
And I can't stress enough how important it is to check your blood sugar and not just rely on that A1C that may be checked every 3 or 6 months. You need to know those day-to-day readings. That's not what the A1C tells you. It gives you the average over a 3-month period, where those day-to-day readings are going to mean a lot more to your provider when you go to the office, and especially if you can explain those day-to-day readings.
Gotcha.
What
was happening
yeah.
So you at McGruder, we have the Certified Diabetic Education Program.
Yes.
I got the letters wrong.
That's okay. Our program is recognized through the American Diabetes Association.
Okay. And so you can help people with everything. Talk a little bit. I give a shameless plug. You go right ahead.
There we go. We do have our outpatient diabetes self-management education and support program. It's actually a 10-hour program spaced out over several months. We do both group classes, we do individual classes. That individual would meet with me for a one-on-one visit to go through their meal planning. Tell me what you normally do, let's individualize a meal plan for you. After that, they would go to a group class. They do the same thing with the nurse. They would have an individual class with our nurse, Amanda. She's awesome. And then they do a group class with her as well. After that, we have a 1-month luncheon and a 3-month luncheon. We check up with you, though. You're not finished after that. You may not have to come back and see us, but you can't get rid of us that easy. We call you at 6 months, we call you at 9 months and a year. We want to know how you're doing, because we know you have the hard part. We're giving you the tools that you need. It's like a toolbox in the middle of the table. We're going to fill that box with all the tools that you need, And you may never need any of them, but if you do, they're going to be in there. So we want to follow up with you and see how are things going. How can we help you?
Okay. And I think I've kind of heard people, if they are diagnosed with diabetes, I'll never have pasta again, or I'll never have cheesecake again, or whatever.
It's like it's this death sentence.
Yes. But I know back in the fall you did Celebrating the Seasons just because of that, because especially at holiday time, people are like, maybe thinking of all the things they can't have. I mean, can you give a few little tips about like some nutrition stuff to make things I can still have?
Especially this time of year. It's a very challenging time of year for anybody, whether you have diabetes or not, but the diabetes puts a few more challenges into it. If you think of it like the food is not the problem with the diabetes.
Okay.
It's the body not using the food the way it used to.
Okay.
But truly, there isn't anything that you can't have to eat.
Okay.
All right. You can eat anything, but it's going to depend on how much of it you're having, how often are you having. I don't believe in good foods or bad foods, but I do believe in healthy choices and maybe not the healthiest choices.
Gotcha.
And we all, myself included, may have not the healthiest choices at times. That's okay. Just don't make a habit out of it. We're human. We like food, especially foods that taste good. You just want to use good judgment.
Right. Okay.
And I would say probably the most important thing, especially this, being newly diagnosed with diabetes, would be make sure you're having some regular meals. Space that food out. Your body, think of it as going to the gas station every so many hours.
Gotcha.
Your meals are giving you the gasoline that you need. Have some regular meals. Get rid of the regular pop. Limit those portions. Maybe instead of this much pasta, maybe have this much pasta. We don't need as much as we like to think that we need. And stay as active as you can. Remember, just tell yourself that's your medicine. That's your medicine that you need. There are some other groups that we do throughout the year. Our diabetes self-management program, that is a program billed through the hospital. So there is a charge for that. We do have some programs that are offered throughout the year, like the school year. So they'll start up in September and they go through May. It's just at the lunch hour at the hospital from 12 to 1. There's no charge, but we hit on some different topics each month. They're called our diabetes get-togethers. We like to have speakers. Sometimes the speaker may be me or one of the other educators there at the hospital. I have a physician coming to one. I believe in March this year. I have a therapist. I have a pharmacist. So I try to get some other people in there.
Some good booster sessions.
Exactly, and there's no charge for those. Anyone is welcome.
Thank you. All right, we're going to take another break and we'll be right back. And we're back. I want to thank Tracy for being here today. Diabetes, kind of a prevalent issue. There's a lot of moving parts to it, but there's some great resources in the community. The diabetic education program at the hospital, oftentimes you'll get a doctor's order for that. The diabetes get-togethers that we mentioned. There's just a lot of good resources out there, so something that can definitely be managed. So thank you for being here. Take the information for yourself, for someone you know and love. Make sure to put it to good use, and until we meet again, please make time for health.